She sang in our customer service presentations that we did.
Wow.
Wait,
Me?
who sang?
I
Sarah.
did.
What did
She
you
did.
sing?
Come on, Sarah. You got to do it. You got to
No,
do
I
it.
Come on,
can't.
sing.
No, I can't
You
now.
can. You
Absolutely
totally
not.
can.
Come on,
You can do it.
acapella.
We're
Let's
not
go.
in the moment. We're not in the moment. And all I said is we got the power. I just happened to sing it. Welcome to Unjargoned, a podcast about healthcare workflows that make sense without all the acronyms. We talk to people on the front lines of healthcare and explore cool workflows they're using to solve real problems. I'm Angie, product leader at Luma Health. I started my first big girl job here at Luma almost 10 years ago. I own all things patient access and getting patients through the front door.
Hey, everybody. I'm Dave Smith. I lead revenue for Luma. I have the great pleasure to have worked with the majority of our customers in some form or fashion in the last 5.5 years. I'm type 1 diabetic, so I often look at the things that we do from the lens of the patient, and we're just thrilled to have you all here.
And to introduce our wonderful guests today. South Lake Pediatrics is an independently owned pediatrics practice in the Twin Cities metro area. They have 4 clinic locations and 32 providers. Thorson here is the director of front office operations and has worked with the pediatrics for 24 years, loves bringing innovative thinking and a customer experience mindset to the front desk. And then we've also got Sarah Laxon, our front office supervisor, and Alyssa Pearson, their EMR analyst. Well, let's dive right in. I think let's just start with a little warm up. Tina, you've been at South Lake Pediatrics for a while now. Tell us about your story about what drove you to healthcare in the first place and South Lake Pediatrics specifically.
I actually started healthcare I came from retail and wanted to change. And so I entered in healthcare as a front desk or receptionist, and the rest is history.
And Alyssa, Sarah, what got you to South Lake Pediatrics?
Same for me. I was also in retail before I joined about 12 years ago and just looking for a new career path.
I was always drawn to healthcare. In college, I was an EMT, kind of just looking at what area I wanted to be in, and I just really liked the back end, the side of it, the implementation, the setup, and so this has been a really good thing for us.
I want to feel included too. So I worked at Trader Joe's all through college, and then Luma was my first job out. So retail to healthcare, kind of same story.
Well, I ran a night deli in high school, and so we're all in the service business here.
We want to feel cool too.
Exactly.
And with that, we've heard South Lake Pediatrics was recently named a top workplace, Minnesota's best pediatric clinic. Can you tell us about what everyone loves about working there? What do you think makes you guys so great?
For the record, this is the favorite question. When we do interviews with new employees, as we're picking them, this is the favorite thing that we always love when we get asked, because all of us say the same thing on it. We're private physician owned. We're big for a small practice, but we're not enterprise. Everybody knows everybody. We walk down the halls. It doesn't matter what position you are. If you're the CEO, if you're a director, if you're, day 2, everybody knows who you are. They're truly invested in things and what's going on in your life. So it's more than just work.
It empowers people to be a team, which is amazing.
And how does that culture and DNA find itself to mornings where it snowed and you have more patients that want to come in to see y'all, and it's just things aren't going exactly perfectly well, because every team goes through that. How does that culture and DNA help y'all to deliver such an elite experience to the community?
Yeah, I can jump on that one. I think it comes down to, you have that family type feel, right? So you're going to have your days where they're not so great, but you can have conversations with each other and say, hey, okay, we got this. We can do it. This is one thing at a time. I'll help. I can take this one. You can take that one. It's kind of that team approach where in some bigger healthcare systems, you don't always get that, right? You're out of sight, out of mind. Oh, this team is over there doing that, and this team's over here doing this, but they're not communicating as a whole. And I think being that small private practice has helped with that. Everybody's got a stake in the customer satisfaction.
And we can just pivot so much easier too. I don't know, it was probably a year and a half ago, Ina needed help at one of the clinics. And I was like, well, I haven't sat at the front desk for 6 years, but I can do it. And so I muscled through the whole thing, but I did it. And
You did.
I think that's the difference with us too is, right? Like everybody is always willing to help one another. Like our CEO will even say like, I'll answer phones, like
Yeah.
you got to help your team. And that's what we do.
Mhm.
How
I
do
feel
you
like
know? Oh, sorry, Angie, go ahead.
No, I was just gonna say, I feel like that explains how great like our Luma partnership has been with y'all too. Like our CEO, CTO will jump on calls as well, and we're like, please don't, but they are always ready to like roll their sleeves up and get to work just like us.
How,
Yeah. For the record, we haven't taken her up on it, but she does.
well, I know that one of the things that we were really curious about was the story behind your front desk innovation. What were the problems that led you to think, okay, we could do so much more. Here's what we should do. Take us from there through the various chapters of where you are today.
Sure. I think when I first started as a receptionist, we were overseen by um, site supervisors, which are our floor staff, our medical assistants, our nurses. And while they do a great job at the care they provide, coming from retail and being so customer service focused and driven, I immediately saw a need for that in healthcare.
Mm.
Kind of became my passion of being more than just a receptionist. I I think there's a lot of misconception around that word that they just check people in when really they really manage the flow of what's coming in, going out. They're the first person that patient's going to interact with and the last patient they're going to act with when they interact with and they walk out that door. So how important is that role and how do you support that? And that was kind of my goal. Like I was going to teach South Lake on what they needed to do to support their front office team. And then Alyssa and Sarah kind of came in and this vision has grown beyond, I think, our dreams and will continue to, I hope.
Before, when we were talking about this, we actually kind of added up our collective years. And like what's unique about South Lake, right, is we have longevity. And so between the
Yep.
three of us, we have 50 years here at South Lake of, collective years and experience and stuff. And then like Tina says, she kind of started first by taking over that scheduling team, right? That was kind of our step one, like unite one process or a team first. And we just kind of built from there. And over the years, the three of us, as we've kind of built and evolved and changed positions and stuff, we actually kind of totaled them up today. And we've had 17 different titles at South Lake between the three of us, if that kind of shows you anything about kind of the growth of the departments and the clinic as a whole.
And we all started as the same one.
Wait,
Really?
that's so cool.
So, Alyssa, how do you, when you observe this journey in the work, thinking about the technology or the EMR, how do you interpret what they're doing and then think to yourself, hey, how do I pair technology into this to create a workflow that wins for everybody involved?
Yeah, we have just our process for that in everything that we do, whether we're looking at upgrade documents, changing something, implementing something new, or even just brainstorming. Everything we do is off of like a PDSA model. So we plan, we do, we study, we act, and we know like it's okay to start something, try it out. If it doesn't work, doesn't mean it's not a reflection on us. It just didn't work for us and we just need to keep pivoting and changing. And I think that's something that we've done very well, and it's definitely been a culture shift, right? Like technology has rapidly changed in even the last 5 years, but in 14 years since I've been here, I mean, when I first started, we weren't on an EMR system with paper charts. And so looking at, going from pulling a paper chart and taping in a shingle for it and scheduling and having everything just be so separate to what we can do now and how we can automate things, it's been a crazy ride.
Yeah, like I feel like taking this retail mentality and the customer service mentality, like it shows for itself based on your reviews. You guys have like 4.5 stars minimum across all of your locations. And I feel like the funny thing about reviews is like someone really has to have a really great experience or a horrible experience to leave reviews. Like the mid-level, like, oh, it was great. My doctor was awesome. They're not leaving a review. So like, how are you guys keeping track of that? Do you have to push anything for that to happen? Is it happening organically? What does that look like today?
I think Luma played a huge role in the success. Everybody is really quick to go to the internet and leave their bad feedback, right? Like I had the worst experience ever. I'm going to let them know it because I don't want to call and talk to anybody. I think with Luma, us sending that message out give us a score 0 to 10 has been awesome. They can leave the feedback, the positive right away. They can leave their comments for 7 and below, anything they want to change. And then we go in there and reread every one of those messages because there's a takeaway with everything that's said, right? What can we do better? How can we improve? How can we support that patient's experience with their own clinic philosophy? But then I also send a Luma message, thank you for your feedback. That's important to us and help us do better, right? So not only am I acknowledging that we got their feedback, I'm also saying, please reach out to us if you have more to give. And I think that has made a huge difference.
Tina, how do your leaders rely on that information? Have there been any changes made to how you do what you do because of feedback?
Yeah, 100%. It's kind of what Alyssa alluded to earlier. We look at what is our problem? How can we fix it, right? So sometimes our feedback is bigger than just, I had bad customer service today, or my clinician wasn't listening to me, right? It's something's, clinic isn't clean. It's, you take that feedback and you go back to the drawing board and you talk to the director team, you talk to the shareholders, and how can we fix it so this experience is better as a whole? You got to take them one by one. It's hard to answer for the whole without knowing what every little message is going to be.
Yeah, for sure.
And I think here too, this is where Tina's customer service, all the years she had in customer service come into play, because it was 10 years ago. Tina was like, we have to bring basic customer service training into perspective here, right? And so we talked about understanding everything from a patient perspective. And we researched all these different training platforms, and every training video we'd watch, they were awful, right? They were so obvious, so many things that wouldn't ever take place in a clinic. And so, believe it or not, Sarah and I created our very own lovely videos. We're not going to share them with you.
Wow.
Oh, come on.
Of real complaints that we got.
Yeah.
And so we put all of it into perspective. We recorded it during off hours, and we actually customized them to every different department. So we had a front office perspective, we had a clinician perspective, medical assistant team kind of a thing. And we took all of our legitimate complaints that we had and we put them into understanding from the patient perspective how it looks or how they took it. Nothing was, how we intended it to be. But bringing that real perspective into play, I think we started with just one team, and then they loved it. So we ended up doing training for all the different departments. And that was a result of Tina being like, we need something real that we can use.
It's all about paying attention. I think, Dave, when we had met previously, you had brought up your challenges with not understanding controlled substance prescriptions and why you can't get more than 30 days at a time. And that was I bet we have tons of patients who have the same questions that we aren't explaining it well enough, that we brought it to the marketing team, and now we're working on making a TikTok and a little video to get out there to kind of explain that for more people. So I think it's being present and really paying attention to the feedback you're getting, whether it's negative or just a comment, is what makes things change.
I mean, you have unbelievable clinicians and providers, but in a pediatrics business, there's lots of options, kind of like a restaurant, a lot of places to get food. But clearly, y'all have just created a culture and a DNA that makes people feel something very different. I mean, that's just so we're clear on the controlled substance, it was for Concerta for my son. Okay.
I didn't want to go in there.
I should probably preface that. I mean, I do say some wild shit here, but
but it makes sense, right? Why can't I get a 90-day supply like I can for everything else, my inhalers and whatever?
Yeah.
Why do I have to go every single month to get this? And that's just regulated by the federal government. That's all we can do.
Yeah, for sure.
Do you feel like a lot of this culture comes from you, which sounds like it does? I was literally on site with another client last week, and they said they would love to reply to reviews, but it always ends up being the bottom of the list of their priorities month over month. And so then I was sitting on site with them going through their reviews. None of them had replies. And so we were just talking about it, and we did another training last week, but is that really going to help when it has to be this massive cultural shift in the way people think and approach how we handle healthcare?
I think you got to make it a priority. I think coming from retail made it a priority. I was a customer service manager for Kmart. For anybody who knows what Kmart was for many years.
Oh, yeah.
That was my top focus, was customer patients, or customers back then. and how to make them happy. And you come into healthcare, and no disrespect to healthcare, has never been a priority. Everybody has to see the doctor, so why make sure they get good customer service? It doesn't matter because they're going to come to us either way, right? And I think that culture has to shift. And when you make
Especially
that
with
a
the front
priority, you're
desk.
going to make big changes.
Yeah, the front desk often is like the face of the clinic as well. Like some people may not ever even see a provider ever. They might just be calling to say, hello, can somebody help me? I think it's amazing what you guys have done.
Let's let the audience hear a little bit of how you're thinking of taking customer service. That's how y'all are thinking of it.
Little bit, yeah. I mean, with the fax box, we're looking at that. We've only had a couple demos. We haven't started using it or anything like that yet. It's definitely something that we're interested in. It's just, it helps. It's a patient safety thing too. When we have AI involved, matching the patient
It gives it
and
that
making it
second
quicker.
set of
Yeah.
eyes. Yeah.
What'd you say, Alyssa? I
Oh,
missed
I
that.
said it gives it that second set of eyes, right?
Yeah.
Like that's the part of the AI and the patient match that we love, so that we're not accidentally attaching it to a similar named patient or something like that. We just were talking with our team lead before, and Sarah was talking about trying to automate tasks, moving people just to one platform versus right now we do some through the patient portal and we do some through a third party vendor for forms, and then Luma, she'd really like to kind of streamline that for her team.
Yeah, and kind of just all encompassing with new patients too. That's something that I would like to do. Like, how can we get a patient registered, talk to them on the phone, and get everything taken care of before that first appointment so that they're not walking in to, okay, now you need to fill out all of your consent forms, you need to fill out a demographic form, we need to verify all this information. How can we do that ahead of time to make that first appointment something that they can come in here, get amazing customer service, and get back into a room and not have to deal with additional paperwork on top of, being on the phone for registration.
It's really inspiring for me to hear this. It's not just a one size fits all. If a product works or doesn't work, you guys are constantly taking it back to the drawing board and finding what fits. And so I think I had some notes here that you guys changed your reminder cadence. And now you have a last reminder that happens 2 hours before. How do you know what's working and what's not working? And how do you finally get to a point where okay, this is what's awesome? And being so open to trying to make that fit to your needs.
I have a favorite saying, pivot. I don't know if you guys are Friends watchers or whatever, but the couch where it's pivot.
Yes.
We're constantly pivoting, right? Because things change every single day. So what worked for us yesterday might not work for us tomorrow. And you got to be paying attention to certain things and adapt and move forward. So what works, like I said, today might not work tomorrow. And let's try something new.
And with the messaging, sometimes you just got to try it. We had some of our one site, we just did a trial. Okay, let's just try and do it. For some of those appointments that get scheduled same day, they were just automatically manually pushing out messages. And the response rate that they were getting before the appointment was amazing. They were getting patients that were doing their check-in ahead of time, sometimes in the parking lot before they walked in and said, hey, I'm here. So their response rate was a lot better when they were pushing out messages same day. So that's kind of where the 2 hours before, we found that worked really well. We had a system where I think it was, 13, 7, and 3. And it was kind of if they didn't respond or confirm their appointment at 13, they'd get a message at 7 days. Well, a lot of our patients wouldn't respond at 13 days and they would respond at the 7 days, kind of where the 8 days comes into it. We just figured 13 days was just a little too early before the appointment, especially in pediatrics where, they very well could feel better or need to pivot.
Do you find, because I feel change management is always a big hurdle in healthcare too, and people want to avoid it at all costs. Even just being let's try this thing. It's no, I can't even deal with that headache. Do you find that it's the people you guys hire I'm just so fascinated by this because this is a breath of fresh air that we don't often get. Even being let's try this message. People are going to manually send out messages for a little bit. Is everyone just instantly on board? What does that look like?
Not all of them, but they know us. They know us.
Yeah.
So they do it for us. And it's usually they need a week or two to be okay, you guys were right. It worked. We love it now.
Or I think they just appreciate that we're trying to make it better. So if there's something right now, we want to reduce the manual work, right? We want that if a family doesn't confirm their appointment, that Luma just automatically sends that next reminder 8 days to 3 days, right? And so I think while change is hard, especially for some people, I think there is more appreciation that we're not just doing change to do change. We're trying to improve it for either, our team or for the patients. So
Yeah. We look at our customers not only as our patients, but also our employees or the people we work with. And we also listen to their feedback and comments and concerns. And, maybe it's something that they bring to us that's a great idea. We should try it and implement it, right? So got to
You
listen to
guys
all
live and
sides of the
breathe
coin.
that. Yeah. That's even something Dave said at our last check-in. It's something you guys take back and think about. Like, I don't know. I want to work there. Don't tell Luma.
Well, I do. So talk to us about the workflow of follow-up care, and particularly when there's an ER visit, because that's for sure one of those where, my gosh, if done right as a parent, it's like loyalty for life. If done wrong, it's like all hell breaks loose. So how did y'all come up with this very creative, unique workflow, and how did you arrive at that?
Oh,
You want?
I can kind of lead in on this. This was another one where we took feedback from both staff and parents, right? Like going to the emergency room is a stressful event. And as a parent, like you just want to feel heard and you want to feel that like everybody knows all the details of your child, right? Like that's your only concern. And so the last thing you want to do is come into clinic for a follow-up and start at scratch and say like here's what happened, as if like the provider doesn't know anything about it, right? The clinician. And so us being able to know ahead of time like where they were seen, so that we can either, if it's a system we can pull the records from, if it's available to us through through the patient itself, or if we have to call and request the records, we want to try and get that information in our clinicians' hands as soon as possible so that they know the backstory going into that patient's room.
What has the response been?
We have like a rate, right, of like complaints or things like that. But I mean, it's worked really well for us. They really don't even know they're providing us that information, right? Like it's all based on like a tree, right? So they say they're calling to schedule or they're online, trying to schedule a follow-up appointment. And Luma just guides them through what type of a follow-up appointment is it? Is it an urgent care ER? And we have more time that it looks for. If it's just, something basic, an ear infection, we only need 15 minutes for it. And so all of that is, it's like your own little step-by-step AI kind of guiding them down into what they have for appointments and availability. So I don't think they really even know that it's a more complicated process, but we're drilling down into offering them what they really need for appointment times.
Oh,
Yeah.
Go ahead, Sarah.
I was just going to say it's more like not that we're getting feedback now, but we're getting less complaints from both parents and staff. So we know that the process is working and we have a smooth workflow. We know the clinician has everything they need before the appointment. We know the patient's going to be scheduled for that appointment and they're not going to slip through the cracks. It's things like that we can tell it's making a difference.
Whose idea was it to get the magnets? Because I think that's actually genius, especially in pediatrics. Like, how did that start? How did we roll this out? Seems so small and simple, but like game changing.
I'm giving credit to Alyssa. Totally.
Wow.
Like she brought the QR code. She's like, Tina, I got the QR code. And that was like for the patient portal. It's like, we can do the online scheduling. We should put it on the magnets. So then she kind of like drew it up and I'm like, took them. I'm like, we have to do this. It's not only is it on the magnets now, it's on our brochures, it's on posters, it's everywhere.
It's on our
follow-up
flyers.
slips. Yeah.
It's everywhere.
It's everywhere.
I love that so much.
For me, I hate paper. And we used to, have these little tiny squares that our clinicians would write on, when they needed to come back, how long they needed for their appointment. Sometimes it worked, sometimes it didn't, right? Like sometimes with kids, like they're so unpredictable. You've got kids that are like wiggly, screaming, crying. Like the last thing you want to do is try and get them to like, stand in one spot while you try and focus on something. Or, we'd tried training our medical assistant staff to schedule follow-up appointments. And while they can, and they do, they're not always available either, right? We're doing shots after appointments or things like that. And so it was like, how can we get it literally everywhere? So they have it as a new patient, magnet with the patient portal, or it's on a poster in the exam room, or they've got, we hand it to them on a card as they leave. Like we want to find ways to not let them slip through the cracks. If we didn't schedule their follow-up appointment with them before they left, and we're not manually reaching back out to them all the time to schedule. So that was
Do y'all have a magnet handy or a QR code?
I can grab. Oh,
Yes, look
There
at
it is.
that.
There it is.
That is
There's our
iconic.
magnet. This is our breastfeeding magnet for like the mamas that tells you how to store breast milk, right?
Oh,
So that's a quick
wow.
little one right there with the portal
Perfect
and
for the fridge.
online schedule. Yep. So it's got that. Then here's our follow-up slip.
Oh, that's so cool.
So
And
follow-up,
that's
and then
so
the back is patient
easy.
portal.
Wait, Alyssa, what are you going to say?
I said we were like, how can we put this everywhere? Like, we want it to be so easy for patients that if they can't schedule when they're in the exam room, right, they've got it on their fridge, or can't schedule on their way out, like they've at least got it so they get that kid in the car seat and maybe they can focus on it in the parking lot quick before they leave or something. Like, it's available to them all the time.
Yep.
And when they get home, like if it's a stack of papers, that usually just ends up on my dining room table. But like I see a magnet, I'll blindly throw it on my fridge. It's just like,
Yeah.
this is where it's supposed to go.
Mhm.
Genius.
Right? Just got our number. Just our number. Well, like the two little, that's all it is. Stick it up there.
Genius.
Yeah, we need to swap swag. I need some of those, and then
I'll mail you some.
we'll send you some sweatshirts.
Okay.
Yeah, there we
Deal.
Yeah. Yeah, but what you're saying though is, I mean, that's that human-centered workflow that, I mean, it really makes sense. I mean, I've joked with y'all before, I have older kids now, but I mean, most certainly I have absolutely experienced exactly what you're saying, and it's a headache.
Yeah.
Because being able to get your next action done, if you don't get it done then, most of the time it's really hard for that to happen. And so just really credit to y'all for saying that. And Alyssa, thanks for the shout out on Luma AI. It's that's magical. The whole company is going to hear about that. They'll love that. Yeah, that's awesome. How is waitlist appreciated? What do your patients say most, least, when you put it in place? How did that impact things?
Yeah. Waitlist is, well, we've always had patient reach out for people we put on a wait list, right? You have your providers who are 4 months out. The problem is you're relying on our staff to have the time to call that patient when we had somebody, right? And that's what took the long time. So the difference of being able to automatically send a message to the next person on the list within a matter of seconds, since when that appointment's canceled, all depending on the parameters that you set the times, right, has been a game changer. It just automatically fills those clinicians' schedules.
Yeah.
It's huge. Again, it's not new. We've always had it. We just never had it automated, which is something Luma does so well.
Alyssa, I have a question for you because you used a word that seems to get a little bit of press right now, AI.
A lot of it, yeah.
How are y'all thinking about AI, and where do you think it makes most sense?
So for us, it's kind of twofold. Some of the things that we've looked at, it's, one, how can we automate things, right? So you're saving time. But like two, HIPAA's my realm. And so for us, maybe even if it doesn't save time in one aspect, we love that, like, the AI helps as a second set of eyes, making sure we've got that right patient, that's in there, or how can we utilize it in the best way possible so that we can put more of our focus back on, patients and being engaged when they're in clinic, whether it's just checking in at the front desk and not, rushing to get to the next task, or it's, the providers in there being able to just have that face-to-face, relaxed visit. So we look at it in a lot of
Tina, what about the way you're thinking about things?
I think AI is a way of the future, and how can we use it as a business, right? So looking at patients, how can we drill down reports? There's a lot of manual reports that come in healthcare, right? Like you have your group of asthmatic patients, you need to run that off the problem list, but who has a score of whatever we deem that need to be seen or for follow-up? Can we drill that down to easily upload the list to get them a message sent they need to come and follow up, right? So we aren't quite there yet, but I'm hopeful for the future that it's something that's going to make our care even tenfold what it is today.
Sarah, any thoughts beyond those?
I mean, I never thought that I would be a fan of AI, but I am. I'm on board and I love it and I want it for everything.
I have many thoughts and many things to talk about, but I do feel like I like this approach of thinking of AI as like a tool rather than our AI overlords taking over everything. So like you guys are always just ahead of the game already. So I can't wait to keep talking after this call. To
Yeah.
close us out, I've never done rapid fire with 3 people, so maybe it won't be as rapid, but I'm still excited. So just
Same,
throw some
same.
questions out. And the 3 of you give me like the first response that comes up. We can go in order. You can yell them all at once. We'll figure it out.
Or you can try to, one up each other.
Yeah.
That can also be spicy and fun.
Okay, first one. If you could teleport anywhere for dinner tonight, where are you going?
I'm going to
I
dinner
think-
with my dad for Chinese food.
We all kind of did this one. I said my grandma's house.
I don't think I answered it when we were doing that.
You didn't.
I immediately thought of I was thinking restaurant. I didn't
There
go
you go.
big. I
Do
was
it.
like, what restaurant do I want to go to? You
Alyssa,
guys
what
went
would-
above and beyond.
Mine would be Culver's.
Hold on,
Culver's.
Alyssa. What would your grandmother make?
Hot dishes.
Like what kind of hot dishes?
She would do, gosh, I mean, I learned her tater tot hot dish. She would do a lot of like wild game cooking,
I love
right?
the
Like
Midwest.
would hunt,
beautiful.
right? So like pheasant chili.
Oof.
She would make these like pizza burgers. Like, just and then desserts, Danish.
And- Amazing.
Their
And then
Minnesota showing.
Yeah, I love it.
Yeah.
I'm
And-
drooling.
Tina, why Chinese food?
My dad cooked Chinese food and he was really good at it. He was
Wow,
taught when he had a young age from a local person who taught him everything he knew, and he was well known in the community for it. Unfortunately, my dad has passed away, but I miss it.
Crazy. And Sarah, what restaurant would you pick?
Oh my gosh, I can't top it. I can't even answer this question. We're moving on from me.
It'd be Subway. You go get a sub.
I've heard those long cookies are a thing. All right, next question. If South Lake Pediatrics had a mascot, what would it be?
It'd be totally a gold star.
we used
Or a planet.
Or
Wait, my elementary school mascot was the Stars.
remember the pufferfish?
we did have
Yeah, meatball.
yeah meatball.
Meatball. When did
Okay,
Meatball
touche.
Meatball go away?
Yeah, what happened to Meatball?
Yeah. How
no,
did that
we
get
used-
voted on?
yeah.
Meatball
Meatball
went to-
died.
yeah.
It was
We had
quite
live fish
traumatic for
tanks
our
in
patients. Yeah.
Haven't
in
seen.
most of our clinics.
But
for a
wait,
long
haven't
time.
you seen the movie where they kind of just replaced Meatball and the kids don't
No,
know the difference?
meatball
We
was
did, and
so
they
big
knew.
and had been there so long that you couldn't replace meatball.
We got another pufferfish, Tina, and all the kids knew. They knew.
No, they knew.
They
Yeah.
used to draw up like pictures, like they missed meatball, so they would draw pictures of meatball
We
and
had a
bring them to the
stuffed
clinic.
of meatball that would go around on different trips, and we would post about it too for a while.
I think
Yeah.
you need a bearded dragon.
Are you gonna come take care of that?
No, but I had one for my son for a long time. He proudly told me, "Yeah, Mom took me and Dad, look at the bearded dragon. It's this big, but they said it's going to get this big." And I was like, "Oh wow, wonderful!" And they lived how long?
Long
Awesome.
time.
Tell your mom how much I love her. Ange, go ahead. What else you
Last
got here? This
question.
is
I know we
great.
love Friends around here, but favorite show to binge watch?
Mine's a Big Bang Theory. I'm such a nerd
Cute.
at heart.
We love Sheldon.
I don't know. I'm a toss up. But Friends is like my all-time favorite. Oops. Another
Oh.
one.
Oh,
Like I feel
good
like you
one.
could just always have it on and watch it. Sarah
Sarah.
usually takes a little bit of a different spin than
Uh-oh.
Tina and I
Yes.
on
Yeah,
shows.
she does.
Sarah, what's yours? And you can't say first
Yeah.
48.
I'm not. I'm gonna go probably Buffy the Vampire Slayer. I used to watch it when I was a
Oh.
kid. I rewatch it every
Solid.
year,
Love that. Is there a time of year you rewatch it?
just whenever I feel like it, and I'll just start from season 1 and slowly mosey my way on through season 7.
Well, that's a wrap. Thank
I
you
know. I
so
think y'all took
much.
it. You took
Yeah.
it. You crushed it.
I'm always down.
I even have my little.
What a walk-up song
Let me see that.
at a healthcare conference, because she sang in our customer service presentations that we did.
Wow.
Me?
Who sang?
I
Sarah.
did.
What did
She
you
did.
sing?
Come on, Sarah. You got to do it. You got to
No,
do
I
it.
Come on,
can't.
sing.
No, I can't
You can.
now.
You
Absolutely
totally
not.
can.
Come on,
You can do it.
acapella.
We're
let's
not
go.
in the moment. We're not in the moment. And
Wait.
all I said is we got the power. I just happened to sing it.
Wait a
I
second.
sang we got the power.
Wait. You might not be in the moment. We are. We want
Yeah.
Come on. Juice up there. Take a little drink.
No.
Yeah, come on.
You've got the Britney set and everything. Let's go. I'm just kidding.
Y'all are awesome. Thank you
Thank
so
you so,
much.
Thank
This is
you.
so
much.
Thank
fun.
you.
Thank you.
Thank you all.
Happy holidays.
You too.
Yeah,
You
you
too.
Okay.
Bye.
Bye, y'all.
Bye.